Welcome to Dr. Dean's bonus video titled Medicaid, Success or Failure. Medicaid was created in 1965 as part of Lyndon Johnson's Great Society. It was drafted as a safety net for medically fragile Americans, specifically the aged, blind, and disabled. The act created a federal-state funding mechanism with 50 voluntary programs to be state-designed and state-administered. In fact, the law reads as follows. Section 1801 of the Medicaid law states, quote, "Nothing in this title shall be construed to authorize any federal officer or employee to exercise any supervision or control over the practice of medicine or the manner in which medical services are provided or given, or over the selection, tenure, or compensation of any officer or employee of any institution, agency, or person providing health services, or to exercise any supervision or control over the administration or operation of any such institution, agency, or person." Yet, over the decades, by controlling our money, Washington has gradually taken over Medicaid so that all state programs are controlled and administered by Washington. Eligibility, verification, benefits, and payments are decided in D.C., not in state capitals. Today, Medicaid claims to cover the disabled, aged and blind, pregnant women, 30 healthy million children, impoverished Americans, and some seniors. Furthermore, in 33 states that expanded Medicaid under Obamacare, the program originally intended for the medically fragile also covers healthy, able-bodied individuals up to the age of 26. Every state gets money for each individual that they sign up. Therefore, there's a very powerful economic incentive to enroll as many people as possible, including some who are not eligible. In New Mexico, 42% of the entire state population is enrolled in Medicaid. A national study recently found that 20% of the 74 million Americans enrolled in Medicaid are in fact not eligible. Most of the money spent on Medicaid goes to insurance companies and federal bureaucracy, leaving very little to actually pay for patient care. As a result, nationally, 1/3 of American physicians don't accept Medicaid patients. In Texas, less than half of the doctors take Medicaid enrollees. Wait times to see a primary care doctor have increased to 176 days with Medicaid, under Obamacare. That's 4 months to learn whether your belly pain is gas, an ulcer, or a tumor. Let's conclude by looking at the scoreboard for Medicaid. In the success column, there are millions of newly insured Americans. On the failure side, the insurance is worthless because people can't get care. Hundreds of billions are being wasted on unnecessary federal bureaucracy. The original intent of the law has been lost. Healthy, able-bodied people are now covered, taking resources away from those who desperately need the support. And finally, the states no longer control their own programs despite the clear intent of the original law. On balance, Medicaid is a clear failure. If you're not already on the website We Can Fix Healthcare, please check it out at www.deanwaldman.com. That's Dean with an E. My mother did that to me 76 years ago. If you click on the blue icon at the upper right, you can access the free videos, the articles, and other downloads. There is no charge for all this bonus material. Thank you for watching and for being part of the cure for our sick healthcare system.